back to Scrubs Anonymous. Today we are going to be talking about dysrythmias.
So, right here we have a normal,
You don't know what it is. It's just normal. It's an ECG strip.
Yep, and
That you'd measure on your patient and would come up on their monitor if you were monitoring their heart, and then you're going to have to evaluate whether it's normal or abnormal to determine whether your patient has an underlying problem.
so the first thing you see here is the P wave, and that represents atrial depolarization. So one thing you want to ask when you're looking at an ECG strip is the P wave inverted or upright? That can reflect different issues going on.
And just if it's present.
Mm-hmm. And the QRS complex is the ventricular depolarization, and then you have the T wave. You also want to ask if it's upright or inverted. In this interval between S and T, you want to see some sort of break, a straight line in between the S and T. If it's not straight, it can represent that it's not fully depolarizing, and which demonstrates underlying issues. So you want to ask, is it fully depolarizing? So is there a straight line in between S?
Is it going back to baseline before it goes into Okay, and then do you want to do this next?
Yeah.
Okay, so when you're preparing your patient who's going to be monitored for to get an ECG, you're going to prepare the skin. So the electrodes, that we call it,
Mm-hmm.
that you're putting on their chest, you want them to have contact with the skin. So if they have hair in the way, or if they have oily skin or any kind of problem, that's going to lead to a false reading, and you're not really going to know what's happening in your patient's heart, and you're going to just get crazy lines, and it's going to look like they're dying when maybe they really have a normal sinus rhythm. So you want to clip excessive hair. You may need to shave the area. Rubbing the skin with a dry gauze to prepare it, and you may need to use alcohol for oily skin, and then you're going to apply the electrode pad in the places that you need to, depending on the situation, and then you're going to evaluate the rhythm that you get, which we'll talk about in a minute with different types of rhythms. But one thing that can happen if you don't properly prepare the skin, or there's any kind of problem, is artifact. An artifact is just going to be a bunch of squiggly lines that you see on their ECG, but it doesn't mean that there's a problem with the heart. It means that there's a problem with the connection. So maybe there's a bunch of hair in the area or something like that.
Or it could be overbone. Placed overbone.
It's just not able to read it correctly, and it's going to look like a crazy ECG, but you need to fix the electrodes so that it's picking up the correct information.
Yeah.
And then we want to go to the dysrythmias.
Yeah. So I'll put this. Okay, so now here is an ECG strip. They're typically in 6-second intervals, and that is how you measure the rate. So how you measure a rate by looking at an 6-second interval ECG strip is you look at the R to R interval. So you want to look from the top of this R to the top of that R, and then that one to that one. And then you just count how many there are. So that's 1, 2, 3,
I'm going to bring it
4.
closer.
So that means that there are 4
intervals.
4 intervals in the 6-second strip. So you want to multiply that by 10, and that gets you a rate of 40. So, and that is considered bradycardia in a 6-second interval.
And obviously there's more advanced ways to do this, but that gives you an estimate to know if the rhythm is fast or slow. But it's obviously not exactly 40, or you could only have like 40, 50, 60. But that just shows you that it's slower than normal and the patient is bradycardic. But in a normal reading, you have a bunch of little squares that you can count up to get a more exact rhythm, and you'll be using like exact measurements with, what do you call that thing that's like a needle? Yeah, you use it. Okay.
And another thing you especially want to look at is if these are equal in between. So you just want to look at a general estimate, maybe with a piece of paper or whatever, and just see if from there to there is the same as from here to here. So as you can see here, it's generally the same here, so they're generally equal distances apart. If they're not equal distances, that can represent different issues, as we're going to discuss later with the atrial rhythm.
But with a bradycardic rhythm, it's less than 60, but it is regular. And then it can occur normally in athletes, so it may be the normal finding in like a 20-year-old patient who comes in and runs every day. You wouldn't see necessarily a rate of 55 and freak out and want to give them medication or whatever. That may be their normal, so that's a good thing to know, that just to assess it based on their baseline and depending on how old they are, but it is still considered a bradycardic if it's below 60, and the normal is 60 to 100.
And certain diseases that can go along with bradycardia or these people present with bradycardia is people with hypothyroidism, inferior MI, hypoglycemia, and increased intracranial pressure. So that's just some things to think about. If the patient has this and it's not typically their baseline, then you start considering these options and looking at their medical history.
Or if you gave them medication because they were tachycardic or something like that, and then they came in like that, they ended up with a lower rhythm, maybe you need to talk to the doctor about changing the dosage or whatever. And then tachycardia is going to be above 101 to 200. So you're going to do the same thing with this. This would be a regular rhythm, and you're just going to count the intervals 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So that's 110. So that would be tachycardic, and it would be abnormal. But it is going to be regular. So it's not going to be
regular distance in between the intervals, and you're going to have all the waves that you see here.
Just imagine it. Maybe Google it.
But it's just going to be faster than normal, so it's going to be 101 to 200. And you're going to see this with sympathetic stimulation, so that can happen with exercise or anxiety. You can see it with certain drugs and stressors, whether that be psychological, mental, or physiological.
And then with both, the way the patients are going to present, they're going to present in similar ways with maybe angina or different just heart problems. And then particularly with bradycardia, they may have cold skin and hypotension. So that's what you can expect when your patient has a rhythm like this. And then we're going to move back over to
atrial.
Can you Oh, we were going to do it like that. Oh, right.
Yeah.
Oh, that's why. Because I was trying to.
Oh.
Is that good?
Yeah, that's good. All right, so these are a couple of abnormal atrial rhythms. So one is atrial flutter. So you see here these P waves are jagged, very jagged, sawtooth waves, and but they have some sort of organization to them. Like there's equal distance between the QRS intervals, but you just have these jagged P waves. And so in atrial flutter, you have 200 to 350 atrial rate. So that's these waves, the rate is going to be 200 to 350, but what you're going to see as the ventricular rate is about 150. And
then both of these, both of these are irregular. Atrial fib and atrial flutter are both irregular. But with atrial flutter, it's regularly irregular, which means just that this rate is going to be regular, and there's probably going to be the same number in between. But obviously this is not normal to have a bunch of P waves, so that part is abnormal, but it's doing it on a consistent basis. It's being irregular consistently, whereas atrial fib is being irregular on an inconsistent basis. So it is a 350 to 600 atrial rate, and then if it's controlled ventricular rate, AFib, it's going to be 60 to 100, and if it's uncontrolled, it's going to be greater than 100. The ventricular rate is going to be greater than 100. But as you can see here, there's 2 P waves here, there's 4 P waves here, they're all crazy. There's 3 here, 2 here. It's just very unpredictable as it's continuing to be irregular. It's irregularly irregular.
Okay, so now we always bring it back to our 80 pi. So first, assessment. You really want to be monitoring your patient who has an ECG attached, or if you see abnormalities, or maybe you see in their labs that their electrolytes are imbalanced, especially potassium, you want to get an order for an ECG so you can monitor that patient. The patient's at risk for these rhythms.
And there's always going to be more clinical manifestations than just seeing it on an ECG strip, and that's not always reliable. So you always want to be checking on your patient and assessing their hemodynamic state and just seeing if they appear to be in distress or what their heart sound like, or taking their pulse actually, and just getting those actual results from the patient so you can treat the patient and not the monitor.
And just a couple diagnoses are ineffective cardiac output and decreased tissue perfusion because the heart isn't functioning properly and it's not in this regular interval. It can cause the heart not to contract or fill as it should be, which means that blood isn't getting to our bodies as it needs to. So,
and if you think about like bradycardia, if that's not the patient's normal and it's only beating 4 times where it should be beating 6 times, that's way less blood getting to the body. So that makes sense.
And then for planning, you just want to think about again what your patient's condition is, and if they need an ECG, and preparing the patient for that by clipping excessive hair if they need be, and planning their treatment and giving meds around it.
And then talking about lifestyle changes, because a lot of heart conditions come from their lifestyle decisions. So if there's a smoking issue or a diet issue or anything, or if they just don't understand what it means that they have an irregular rhythm, teaching them what that means and how they can improve their lifestyle to improve their heart.
Yeah. And that goes along with implementation as well. You want to obtain that ECG.
I thought you were drunk. Sorry.
No, it's fine.
Yeah.
And then evaluate your patient afterwards.
For a return to normal rhythm, or if they used to be in a tachycardic state and now they're all of a sudden in A-flutter, updating other medical team members. So that is Dysrythmias. If you have any questions, please let us know and comment below. We try to keep up with them all. There's a lot, but we love you guys. And peace out.
Okay, so one of the questions we got in our comments that we want to answer by one of our mini subscribers.
we got asked by Abby, I can't remember her last name, but it was Abby something, about how to deal with tricky roommate situations, which can be really, really hard. Both of us,
my roommate is really struggling.
So, well, mine's fine, but
yeah,
Jess has trouble with hers, definitely. So we're just going to give you some helpful tips, and Jess has the first one.
Yeah, so one of the first ones is to, especially on clinical days, you want to make sure your alarm goes off at least 20 times, because you'll have a better roommate relationship if they get up with you at 5 a.m. in the morning.
It's really good bonding time.
Yeah, it's really
You're
good
both
bonding time.
Tired, but you also are more probably alert at that hour than you'd ever be, at 8 a.m. or a normal time to wake up. So.
Yeah, and if they're up with you, then they can't get annoyed at all your alarms. So
Yeah, and if you're like moving around a lot and like eating your breakfast and they're up too, it's probably less annoying. So
Yeah.
when it's at at least 20, probably 25 to 50 is ideal.
Yeah.
Another great way is to just to be really passive aggressive. If you ever have like an issue with them, or like you, I don't know, just are annoyed by something they're doing, instead of like going to them and like addressing it and dealing with it, you want to just be really passive aggressive. That way they'll kind of get it without you ever having to confront, and just kind of like deal with it like a normal person. So that's really a great way.
Yeah, for sure. Just like hiding their shower stuff. And
yeah, that's a good one.
Yeah.
Personal experience.
Yeah, and it just brings satisfaction, to the relationship.
And then to finish it all off, bleaching their clothes.
Bleaching their clothes.
All of
it's just completely like passive aggressive, and you clean their clothes while
That's
you're
just
doing
aggressive.
it.
That's not even passive.
You clean their clothes while you're doing
Yeah.
it. So
They can't complain. They
Yeah.
just have
very white clothes.
very white.
So,
Yep.
yeah.
So that's just a few things we've learned. We've been at school for 2 years, so we're kind of experts in how to deal with roommates, and just it's hard to live with people. But if you follow, I think, our tips, that's your best chance.
You're gonna
for
have
success.
a very content
Yeah.
filled relationship.
That's all we got for you. So please comment more questions below. We'll be sure to answer them and get back to y'all. And that's it.